The first strategy I want to look at is dealing with health inequalities, and that's the 7-day NHS. The current UK government, as we know, they're very individualistic, want to try and deal with an inequality in health by changing the way the NHS works. There is obviously an inequality in health in the UK between people of colour and white people, between different areas of the country, and crucially between people living in poverty and those who are more well off. The UK government wants everybody to have the same access to their GP 7 days a week, whether it's a Monday or a Sunday, they want them to have the same access to their GP, and the NHS should provide the same level of service to patients every day of the week and as quickly as possible. They think that current waiting times for GP appointments and hospital appointments are unacceptable, and they've said that anyone who needs urgent or emergency hospital care will have access to the same level of consultant assessment and review, diagnostic tests, and consultant-led interventions, whatever day of the week it is. And in order to help achieve this, the government has made some changes to GP opening hours, hospital doctors' contracts, and is planning to stop consultants from having the opportunity to opt out of working weekends. Essentially, they're spreading the resource that the NHS already has more evenly over 7 days. Now, an example of this is that the government now requires GP surgeries to be open from 8 a.m. to 8 p.m. every day, unless they can prove that there's no patient demand for this. So if they go, well, look, we're open till 8 every day and nobody's coming after 7, and they can then change their opening hours a little bit. But if they do not do this, if they do not open from 8 a.m. to 8 p.m. every day, then they will receive less funding from the government. So essentially, they're forced to do this. Now, individualists argue that this is reducing inequality by making it easier for people to visit their GP and reducing hospital waiting times. And they would argue that it's of most benefit to people on low incomes who may not be able to get time off work or be able to afford to spend hours in A&E. The government says that currently a lot of people who go to A&E don't need to be there, and they could go to their GP instead. Well, that would mean a lot less pressure on the emergency services. They think that this idea of a 7-day NHS can help spread the load and can also be more efficient. And they're providing an additional £528 million a year to GP practices to ensure that this target can be met. But collectivists say that this idea of a 7-day NHS isn't really feasible, and it's also a bit misleading. The UK government is saying that we need to have equal treatment across all 7 days, but we already have equal emergency service coverage all over the week, all 7 days, 24 hours a day. When I had to go into hospital for an emergency appendix surgery, I went in the evening. I got my operation happened at I think 2 a.m. So there already is this for emergencies, and the government is saying, well, they want to have this for non-emergencies. They want to have all kinds of hospital services, all kind of surgeries, all kind of appointments, etc. done throughout the week, and they don't want to have fewer done on a weekend. But collectivists say that will require paying for. And the current government have just been completely unwilling to increase the funding to the NHS and actually cut its budget by 0.6% in 2018 to 2019. Now, the Health Secretary says, oh yeah, we've put an extra £10 billion into the NHS. They haven't. They've put £10 billion in, but because things are getting more expensive, the amount they need to put into the NHS needs to increase above that. And even that £10 billion has been criticised and has been challenged by the Parliamentary Health Committee and other experts. NHS trusts across the country are running up huge debts, and the British Red Cross declared the system was facing a humanitarian crisis and needed more investment. You can't just spread what exists there over more days. It's like the line from Lord of the Rings about feeling like butter spread over too much bread. It'll get too thin and there'll be cracks in it. And this was before we had the coronavirus health pandemic. Now, NHS trusts are really, really struggling, and we saw what happened with the lack of PPE in 2020 and a lot of the problems of actually dealing with the coronavirus pandemic itself.